Do you have health insurance? Whether your answer to this question is yes or no, the issue of healthcare coverage applies not only to everyone listening to this speech, but to every citizen of our nation as well. Healthcare reform is a term we hear often, one that plagues the headlines of news articles, television broadcasts, and even radio talk shows. This issue is at the forefront of political policy changes since the most recent presidential election, but has been up for debate and personal interpretation long before that. The Affordable Care Act, otherwise known as Obamacare, are likely terms you've heard as well. But what you may not already know is that these policies are already impacting your day-to-day life. Many of these changes were implemented with little bearing on your day-to-day life, but open up the doors for all people, rich or poor, young or old, ill or healthy, to have access to affordable and reliable health care. You might be wondering what's the issue here. Our current president and many members of our Congress wish to make changes to the current health care bill, limiting the access to affordable primary coverage, reproductive care, and lowering, if not eliminating, the subsidies given to those on government assistance. Repealing and amending any of the current policies is not only unnecessary, but also detrimental to all of you and all of our great country, too. As a future registered nurse and longtime healthcare worker, the implementation of the Affordable Care Act directly improved my ability to provide immediate and sometimes life-saving care to those that need it the most. No longer do I have to worry that patients would be turned away due to the lack of their insurance, but all of this could potentially be in jeopardy. We as a country and as people need to remember our humanity instead of focusing on costs and taxpayer dollars before making changes to our current healthcare bill, the Affordable Care Act. Our president, Donald Trump, has publicly demanded for there to be a change in healthcare policies, even taking to Twitter to call for the public support for the repeal of the Affordable Care Act. His proposal, creatively called the American Health Care Act, is detrimental for more than one reason. The American Health Care Act would leave millions uninsured, rendering them unable to access preventative health care. The Congressional Budget Office stated that if this bill passed, up to 24 million Americans would lose their health care coverage. This number alone should tell all of you how detrimental changes to the Affordable Care Act could be. People without health insurance that need preventative care, such as those with diabetes needing insulin or those with heart disease needing blood thinners, could potentially be faced with losing access to their daily medications. Another aspect of this proposal that affects me and likely many of you, my classmates and colleagues, is that the Affordable Care Act allows young adults to stay on their parents' insurance up until the age of 26. The proposal of the American Health Care Act would potentially leave many young adults, up to 3 million of us, without health care coverage under our parents. For most college students and young adults, this would force us to seek health care coverage through employers or through private pay, which can be expensive month to month. After the implementation of the Affordable Care Act, the national uninsured rate for non-elderly adults, you and I, fell to nearly 7 percentage points, according to the Center for Disease Control. The uninsurance rate had fallen to 8.9%, the lowest level since 1972. A common misconception is that the people primarily using the Affordable Care Act are unemployed, which has been proven to be untrue. Like I stated previously, many of us college students and young adults in the workforce are insured under their parents. This coverage was made possible only by the Affordable Care Act. Are you still unconvinced that these changes are potentially detrimental? What about those of us with chronic pre-existing medical conditions, specifically those of us whose conditions exclude us from the workforce and the ability to have health care coverage through our employers? Examples of these conditions include, but aren't limited to, asthma, diabetes, cancer, and depression. The Affordable Care Act implemented a provision called the Pre-Existing Condition Insurance Plan. This allowed 130,000 more Americans to have health care coverage. This may seem like a small number in comparison to our entire population, but these people usually need medications and regular doctor's visits just to stay alive. Sometimes these conditions are so critical that they even require hospital stays and emergency room visits. Without health insurance, these 130,000 people would be forced to pay out of pocket for their hospital visits, which add up quickly and are entirely out of our control. Many of these people are unable to work, as I stated previously, so their ability to pay these bills out of pocket is limited and sometimes impossible. The proposed health care bill, or the ACHA, was rushed and not well thought out. The solution to this problem is simple: a single-payer healthcare system. Put simply, this would be Medicare for everyone from the moment of birth to the moment of death. This would ultimately replace the need for the current Medicaid system. Changes in policy of this magnitude are time-consuming and costly, but that doesn't mean we should abandon hope entirely. The Affordable Care Act took years of time before it took effect, but ultimately helped millions of our citizens get health care coverage. A short-term solution to a long-term problem is for all of us, including all of you, to educate ourselves about the current policies and how they're already helping us. Change starts with all of us, but in the case where change isn't necessarily needed, the responsibility still falls on our shoulders. Grassroots democracy is something that has the ability to influence policy changes from the bottom up. Write a letter to your senators, your congressmen and congresswomen, speak up, and let your voice be heard. At the very least, form an opinion, even if it is different from mine.